You want healthy, glowing skin, but with all the products, trends, and conflicting advice, it's hard to know what actually works. I understand. I am Dr. Tina Meder, a former cardiologist and specialist in the skincare development and cosmetic safety expert. I've spent years studying the science of skin. Welcome to Meder Beauty podcast, where we uncover what really matters, break down the science, and give you real expert-backed skincare advice. Whether you're looking to achieve radiant, healthy skin, curious about anti-aging, or want to understand what's really in your product, you are in the right place. Rooted in science and the truth about what your skin actually needs, we'll have in-depth conversations with leading dermatologists, medical experts, and skincare brand founders to bring you the latest innovations, evidence-based insights, and industry secrets that truly make a difference. We are so happy you are here. So let's go. Hello, Sarah. Thank you so much for joining me again. And today we decided to discuss the serious topic, which I hope can be very useful for our listeners because we meet different things in life. And today we will be speaking about the skincare during the cancer treatment. It is a hidden problem and not a lot of skin practitioners take a risk to speak about. So let's be open about it. Yeah. Tell me about your experience.
I do want to say that on behalf of my other estheticians and practitioners, especially anyone who is just getting into the industry, I just recently met a practitioner who this is her focus. This is what she wants to do, is treat patients with cancer. So I want to say it's an honor to be here with you. A lot of people underestimate that you are a cosmetic safety expert. So safety is what you know. And so on behalf of them, I want to ask you as much as I can, when you ask me about my experience and if I've treated patients who may be experiencing cancer, a few times it has come up when I was working in a space that had a lot of active treatments. Of course, it had to become a concern. We had a very well-rounded way of treating our patients. So you just didn't come in for a facial, you came in for a consultation. We did what we called like building your skin from the mattress to the sheets. It is so much deeper of an issue a lot of the times, whether it's volume loss or deep pigmentation. So going into that, you may have met with an injector. You would have met with me who would have been using lasers and devices. Of course, also there was the side of maybe I would be giving you facial treatments to lead up to you being able to handle those active treatments. But a question we had to ask then, if you were going to meet with an injector or use devices, are you experiencing any active treatments with your doctor? Are you under cancer, undergoing radiation or anything post-cancer treatments? And there would be a few clients that would have to say either yes or I'm in remission right now. And I felt like, where do I go from here then? Because I'm having a consultation with you to hand you over to my injector who now you cannot speak with probably for some time now. I can't touch you with devices and I have a lot of active treatments in my treatment room. So what can we do? And a lot of the times, I don't know, I saw the value in treating them with something that would reduce the inflammation. It would be really calming to their nervous system. You can't touch things like microcurrent and ultrasonic spatulas, like even the most simplest of devices that are so beneficial to the skin. But I had a long way to go in understanding senescent cells and why you wanted to avoid stimulation for a patient like this. I guess I turn that over to you with the value of understanding what is happening in a patient's body when they're experiencing this and then what can we do?
So that's a whole uncertainty for patients and for the skin practitioners as well. Yeah. But you are a medically licensed esthetician. Yeah. Did you have any kind of training during your education period?
I think we had education on what not to do. Avoid your devices that would stimulate your retinols, your acids. So a lot of the things that I think our spaces take on because they know that's what can create change. And there's not a lot of value in doing a lot of just really calming and inflammation reducing treatments, which of course you love a mask and you love something that's really calming and soothing to the skin that's not active. But in the spaces where I was working, the focus was so much on how can we activate the skin that I think I just didn't see the value.
I think it's very interesting because it's already a good basis. We don't stimulate the skin. We don't use energy-assisted devices. We don't use any aggression. But what I think where we should start, first of all, probably we should change a little bit the point of view because as I see, I'm practicing in the beauty industry since mid-90s. So during my 30 years I've seen a lot of situations, and what is really bothering me is this negative, tragic point of view, because when someone is diagnosed with a cancer, it always sounds like a huge tragedy, and the diagnosis is very serious. The prognosis of different types of cancer can be different. What we should understand, then, medical science progressed a lot. And now many types of the cancer, they are still serious, but sometimes they're not life-threatening. And we have a lot of very efficient treatments. And also there are a lot of research which prove us that people with positive approach to their treatment, they go through this treatment better and they live better. They quality of the life doesn't change so much, and the life quality is very important for the results of the treatment and for everyone around you. So I think that the role of the skin practitioners at this period of time should be something like you bring positivity.
What I loved about a blog I read for you is that you spoke specifically about practitioners in France who focus on patients with cancer. Is that what you're about to get to?
And that's a whole kind of social movement, which started with the help of real beauticians from different small towns in France, from Paris, from big cities. And they all united, creating this system, helping female cancer patients in the first place. So they started to come to the hospital, offer the manicure, some simple facials, and they discovered, and actually doctors, oncologists, they found that helped a lot. That helps a lot for remission. They help people to go through the treatment better, to get better results. Simple thing like manicure. I think it absolutely makes sense because it's deeper than skin. And this positive approach, I remember when my grandmother was in deep state of dementia, she already didn't knew who am I. But every time when I gave her the manicure or something simple for her face, she became herself again. And she recognized me. And I think that's something about the dignity and the quality of the life. So I think in the first place, what we shouldn't do is make this frightened face. When someone is coming and says, I am in the remission of the cancer, we should not go, oh my God, I cannot offer you anything. Everything is bound. Because not everything is bound. Why we have these limitations in the cancer treatment? First, we should understand what is the period of the cancer treatment we are dealing with. Because that will be very different. When it is someone in the remission for 7 years, it is literally a healthy person. Yes, they got cancer in the past, but 7 years later, for most of cancer types, 5 years is the critical period. So if you have the stable remission, it's very possible that you are out of danger. You are in clear situation. You can live with no limitation, but obviously, after such an experience, people have a tendency to be more careful about their lifestyle.
Of course.
And it is good, right? They don't damage their skin with the sun so much. They eat healthier. They do a lot of things for themselves because they understand the importance.
Absolutely.
Another thing, if it is someone who is recently diagnosed with cancer, emotionally, it is a difficult period. So not so many of these patients, they are coming to our clinics and in the zone. And unfortunately, I don't think that in America, we are in the place when beauticians are voluntarily coming to the cancer hospital offering this service. Probably not. I hope it can be in the future.
It's interesting because it's so funny. I don't want us to get so all over, but as we listen and I'm telling you this young woman I've just recently met who's getting licensed as we speak, and I wish you the best of luck, girl, and good luck on your state boards.
Yeah, good luck.
But her focus is, I want to go into rooms and I want to treat patients who are experiencing cancer. Another woman I met, she's a nurse. Her goal now is from after being in triage, like, I want to work on relaxing treatments. So I'm like, there almost needs to be a residency for us in esthetician school of who do you want to work with and how can we help you do that then? Because
and I think it would be great as we as a brand and other brand can support this initiative because it would be great. We can offer masks and just to help them to feel more comfortable.
Yes, because even as we talk, something you also can't perform lymphatic drainage. We all know how much of a buzzword this is and how popular this treatment is. But you were saying, so someone's just diagnosed and they're coming to us. I love this idea because you're almost allowing us to sit down and say, okay, so tell me where you are in this journey so that I can figure out where I can fit myself into your life and I can support
what we
you.
can do and what we cannot.
Yes.
Thank you so much for mentioning lymphatic drainage because it is very important.
Yeah.
It is the first signal in the situation when you are undergoing cancer treatment, and at least the first year after the cancer treatment. Why the lymphatic drainage is absolutely forbidden? Because cancer cells, they are traveling in lymphatic system. They are metastasizing via lymphatic system. That's why we don't want to push lymph to speed up its movement, so it should stay natural. Obviously, we will not slow down it, because it's very important. It's a natural way to detoxify the body, but we will not speed up it. We will be very careful about it. Lymphatic drainage, it's not only the massage called lymphatic drainage, because all types of massage, all types of body massage, they speed up the renewal, they speed up the lymphatic drainage. So unfortunately, we don't go for massage in the recent phase of the cancer, with a small exception, very gentle, relaxing massage, probably upper part of the back. And maybe arms and hands if we are not speaking about the breast cancer. But I will be very careful about it. And this interdiction, it will stay on place at least 1 year after you finish the full course of the treatment. Because still the first year is critical, so we should be sure that your cells are on the place. We are not push them to travel. And also lymphatic drainage, they can be some unexpected situation when people don't understand that actually why we don't use microcurrent therapy, because microcurrent therapy is very efficient in lymphatic drainage. We love it in healthy people, but in cancer patients we prefer to stay away. And also microcurrent therapy is energizing.
I was going to say, I can imagine we want to give those cancer cells a boost in ATP, right?
Especially speaking about the skin cancer, when it will be completely forbidden. And also it's no real scientific consensus about it, but we are just staying in the place when we don't perform microcurrent therapy, we don't perform this lymphatic drainage with pressotherapy, no way. Only if it is prescribed by the doctor, because sometimes after the surgery, when all lymphatic nodes, they've been taken out, and the doctor is sure that the tumor is eliminated completely, but lymphatic system was damaged and traumatized, sometimes it can be prescribed by the doctor, but it will be physiotherapy. It is not an aesthetic therapy. And obviously, at this period of time, we don't use any of energy-assisted devices, not because the laser resurfacing can somehow make the cancer progress. 99.9% it will not. But regeneration is affected by the condition, and also the regeneration of the skin will be affected by the therapy, because what we use for the cancer treatment. Now, when we have this amazing progress of the science, we have the whole range of cancer treatment, which should be very specific for different cancer types. X-rays, still. For many types of cancer, we use it, but X-rays, they are damaging, so it is a ionizing radiation in our body, which kill cancer cells, but in the same time also kill the healthy cells. So you need to be in your detoxifying mode as much as you can. You should eat healthier. You should drink a lot of the water. You should try to sleep better if it is possible, to stay physically active as much as it's comfortable for you. But we will not go for plastic surgery. It's just logical.
And also, as we're talking, what we can also naturally say is we know a patient who's experiencing this, their wound healing, right, is being affected. But naturally, we think of, I will grab something with stem cells or something with growth factors.
No,
we will not for the patient who's undergoing cancer for obvious reasons, but it's to turn that mind off and say the way I naturally handle wound healing in a healthy person versus someone undergoing cancer treatment.
Absolutely. Because the wound healing, it's non-specific reaction in our body. And stem cells and growth factors, they also can be reacting non-specifically.
Yeah.
I don't see the real danger if you apply products containing plant stem cells, because they are not so stimulating. They are not going to stimulate any kind of cancer types of your cells. Because they're not absorbed by the body. Right. They act topically. Same for growth factors applied topically in the skincare products. But no way to inject it. No way to inject anything potentially stimulating, because you have this wound already, and your body is very much focused on the wound healing in the specific place. So we help it conventionally using boring, simple, easy lifestyle changes and everything prescribed by your doctor. But please do not improvise, because you should be careful. And another types of the cancer therapy, the chemotherapy. So the principle is the same, but with an X-ray therapy, we just go with radiation in the location of the tumor. But with the chemotherapy, we are using different kind of chemical substances which can be toxic for tumor cells. Ideally, they should not be toxic for your body, but we are not living in the ideal world. So literally everything which is used in the chemotherapy is hard. It damages your cells. That's why it feels so difficult. It's absolutely draining. You don't have an energy. It's a lot of nausea, a lot of pain, so it's a difficult period of the time. And it would be great and then absolutely recommend to use appropriate skincare in this period of time and to use some easy calming procedures, hand care, manicure, pedicure. You should use a lot of moisturizers, because chemotherapy and X-ray therapy, what they have in common, they dry off your skin because they affect your microbiome and they affect your lipid barrier. So you should be prepared to get a lot of new nutrition for your skin. So you should use this nutritional, nourishing moisturizer for face and body. And actually the best thing, you know how passionate I am about antioxidants. And use of antioxidant supplementation during the cancer therapy, it is very much under the question. Chemotherapy and X-ray therapy. It's at some point, it is a therapy with free radicals. We don't love free radicals most of the time, but when you have a cancer, free radicals
is to kill the cells.
It's to kill the cells, to kill cancerous cells. What free radicals can do. So we should not fight them so much. But for the skin, it would be great to use antioxidant-specific skincare. It helps to restore the balance of what we call antioxidant balance in the skin. So we will get enough of free radicals for the normal skin metabolism, but enough of antioxidant to keep a balance. And what is the best antioxidant for the skin during the cancer therapy? Easy one. Vitamin E. Alpha tocopherol. Absolutely the best one. So when you see skincare products based on some organic oils enriched with the vitamin E, go for it. It's a great solution for everyone undergoing the cancer therapy. And a lot of them, they are affordable. They're not very expensive, so you can use it generously for the face and the body. Also, another great ingredient for this period of time is Centella asiatica. It is antioxidant, it is anti-inflammatory, it protects cells' DNA, so that's another, and it's called Zika repair in many of cultures, because it's very famous in traditional cultures of Southeast Asia, in the Madagascar, Indonesia, and it's called tiger wood, it's called Zika wood, because it's a Zika herb, because it helps to restore the skin, to repair the metabolism.
It makes complete sense.
And other antioxidants like aloe vera. It sounds absolutely simple, but aloesin, which is active ingredient of aloe vera, is amazing for the skin undergoing the chemotherapy. It can be green tea. It can be red grape extract. So all of them are good for the skin. Chamomile, marigold. And many of plants.
Anything soothing, essentially.
Yeah.
Anything that's soothing promotes soothing without promoting it from a regenerative standpoint. Because, of course,
Exactly.
my favorite antioxidants are all very regenerating. So it's like turning your brain off to say your favorites for obvious reasons and realizing what is our goal here, what is our focus, is soothing and calming without putting you into a like fight and flight mode in the body.
Yeah, absolutely.
Yeah.
And also the chemotherapy and the X-ray therapy put you in the position when your skin is photosensitized.
Yes.
So it's
Yes.
less protected from the
Sure.
ultraviolet. So
Sure.
another thing to think about, it's to use the maximal protection from the sun. Not only the sunscreen, but sunscreen should be 50 plus. But also please think about buying the new beautiful hat,
Yeah, absolutely.
big beautiful sunglasses. You're worth it. You should be this celebrity style.
Honestly.
Someone, that's the time.
Honestly.
And also covering clothes.
Yeah.
Please cover your arms, cover your hands,
Yes.
cover your neck and décolleté with something light.
Yeah.
Because it will help to protect your skin much more efficiently. Because at
Truly.
this time, you will be very sensitive.
Absolutely. And never more important, obviously, like we've mentioned in other episodes, check that UV index. Be mindful of it. Get into the habit of understanding life isn't over. It doesn't mean you can't enjoy the sun,
Absolutely.
but
You do it for your future.
Yes.
Because in a few months, your therapy will be finished successfully. What I wish to absolutely everyone going through this difficult period of time. But in the life past this therapy, you don't want your skin be damaged. You want your skin to be healthy and beautiful and not sagging. And we can prevent it. Just we don't use any stimulative ingredients, but what we can use? Calming antioxidants, and we are using a lot of moisturizers. Because as I mentioned, the skin will be dry. It's absolutely normal. The best way is to start to use these nourishing moisturizers at least a week or couple of weeks before the treatment starts, so how you avoid the discomfort in the first place. And I always suggest and always recommend to get this small stock of hydrating masks.
Yeah.
Because it would be great in the normal situation, right? In the normal life, we always recommend to use moisturizing mask at least a couple of times a month.
Absolutely.
But undergoing cancer treatment, I always recommend to use a mask a couple of times a week.
You know, I have a question for you for the person who likes to do their mask but likes to ice roll, because we're talking about avoiding stimulation. Even using ice rollers, using things that are cold on the skin while you're undergoing, does that create so much stimulation that they should avoid it? Because I know plenty of patients who experience sweating, experience discomfort from heat in the skin while they're undergoing these type of
You
treatments.
know, I think that ice roll is pretty much safe.
Okay.
Because it's a physical stimulation, but it's very natural. If your skin didn't develop the cold allergy, what can happen sometimes, unfortunately. And if it is a swelling and puffiness, ice roll can be a great solution, but also you can put your hydrating mask, especially sheet mask, my favorite, in Medar, we have only sheet mask.
Absolutely.
You put in the fridge, not in the freezer. And you use them cool. So you can avoid to use ice roller. You can use just a simple roller, like jade roller. Blusher. Gently, very superficially, without any pressure, just to help your skin to eliminate this excess of water. But remember, we don't want intense lymphatic drainage.
Absolutely.
So just lightly. And also devices, probably everything except for blue light therapy, I will say no.
Okay.
Blue light therapy will be still good because it is anti-inflammatory,
Sure.
but it is not stimulating.
Yeah.
So we can stay with the blue light, with LED devices, LED masks, hydrating masks, calming, desensitizing masks, but please do not use any mask promising you some kind of regeneration or lifting or rejuvenation or something like this.
Right.
Some people, about 20-25% of the patients, they can develop acne. It's chemically induced acne, but the mechanism of acne development is different because it's not based so much on the hyperproduction of the sebum.
Sure.
So you don't need intense product for the oily skin. So we don't looking for reduce the sebum production so much.
Sure.
Sometimes we don't have enough of sebum. It's mostly immune reaction on the skin.
Okay.
And first and foremost, microbiome affected by toxic chemicals. So another thing which I recommend to all cancer patients, prebiotics and probiotics.
Okay.
And actually, the supplementation with probiotics, especially with lactobacillus, can be very helpful.
Okay.
And now there are a lot of new scientific research about it, how it helps cancer patients. And a lot of oncologists, they recommend now probiotics and prebiotics because it helps to maintain gut health, which is very important.
Absolutely.
Because gut health, digestion,
Yes.
less of nausea,
Yes.
less of digestive problem, less of diarrhea.
Very
So we use it now. But also I recommend to use prebiotic, probiotic-based product on the skin. And also I absolutely recommend to switch to biological deodorant
Okay.
in this period of time.
Okay.
Why? Because aluminum-based deodorant, let's say they are not cancerogenous. Like,
See, I'm so glad because I was afraid to ask her. I was like, is she going to kill me if I go there? But
Yeah.
yes.
I will not kill you. I said myself. Actually, they don't cause cancer.
Okay.
And there are a lot of safety reports.
Okay.
Proved aluminum deodorant to be safe even in the long distance use. The problem lays in the different place. Aluminium block sweat glands.
Which we
When-
need in order to remove toxins.
Absolutely.
Right.
Absolutely.
The function that's being blocked that's the problem, not the
Yeah.
actual ingredient.
So if you block your sweat glands,
Yeah.
you limit your body ability to detoxify itself. And it is very important during the all types of cancer treatment, even the most innovative genetic therapy of cancer, which is great. And now for many types of cancer, they develop the new genetic therapy and it's more comfortable, but it's so modern. So it doesn't affect the body so much as toxic chemicals. But at the same time, you still need natural detoxification.
Yes.
And so please, leave your sweat glands be. Stop use aluminum-based deodorant. Switch to the deodorant based on the biological ingredients, such as prebiotics, probiotics, interacting with your microbiome. It helps with an odor. It can even make you sweat odorless. Like I'm very proud about our deodorant in Meder. I love it.
I remember you said there's just a transition period with that, right? That absolutely happens, that naturally as your body goes from blocking the sweat glands to experiencing the sweat coming through, you're ultimately removing toxins from the body. So that period of switching to deodorant just smells different for how long?
Yeah, and actually under the cancer therapy, sometimes the sweat switch, it smells differently already, and sometimes it doesn't smell nicely. So what I always recommend when you're stopping to use aluminum-based deodorant is to acidify the skin slightly in the all sweating area, underarms, in other area of the body, because it helps to restore the healthy microbiome, because all the smelling bacteria, they're more alkaline. So the easiest advice, and it's come for free, you take lemon juice.
I knew it. I was like, is she going to say the iconic lemon under the underarm?
Yeah, just lemon juice, just not too concentrated. You dissolve it with the water. And after taking a shower, you just take a cotton pad. Just apply a little bit of dissolved lemon juice in your underarm or other area of the body. And after, you apply biological deodorant.
Thank you for explaining that, because I think that even some of these small little myths can appear online. I think as long as people understand the why behind something, because the sweat is more alkaline. So just acidify. That makes complete sense.
Yeah.
It's not down to squeeze a lemon and it's killing bacteria.
It's not magic. It's not like you want to kill bacteria. We don't want to kill them.
We don't.
They want to rebalance them. So my advice is switch to the sensitive skin cleanser. Something very nice and gentle, microbiome friendly, kind of emulsion, creamy cleanser, not foaming. Exactly, because all foaming cleanser, like salt-like cleansers, they dissolve lipid mantle. Step 2, find some anti-inflammatory, antioxidant product, calming, based on Centella, based green tea, aloe, and your moisturizer should be nourishing. Even if you've had an oily skin before the treatment, that's a high probability your skin will be dry and will feel tensed and uncomfortable. So to prevent it, We use these nourishing moisturizers
Absolutely.
based on organic oils such as sweet almond oil, sunflower oil,
Absolutely.
a lot of them.
Yes.
Just be careful with moisturizer based on butters, not on the
Okay.
oil. So I will not recommend coconut
Okay.
oil because it is full of lauric and myristic acids, and they are photosensitizing.
Right.
And they are pro-inflammatory.
Okay.
And skin under the cancer treatment, it's already in the
Right.
pro-inflammatory condition.
Sure.
So we don't want it to go this way.
Yes.
So stay in with oils,
Okay.
not with butters.
Okay.
Only exception, probably, I will say shea
I
butter.
was going to say shea butter, please.
Shea butter, shea butter, which is great
Yeah.
for all types of the skin and sensitive skin as well.
Sure.
Vitamin E,
Yes.
look for it on the label.
Yes.
Use hydrating mask based on the hyaluronic acid, maybe glycerin,
Yeah.
carrageenan, twice a week,
Okay.
and use the most intense sunscreen
Yes.
every time when you are going out.
Sure.
And nice hat, sunglasses, all these clothes, everything. And biological deodorant. So you're covered for the period of the treatment.
Period.
So with this you go through, you don't need any kind of intense treatment.
No.
So no surgery, no injectables. It's formally forbidden. FDA doesn't recommend it. Any kind of energy-assisted treatment. And even sometimes, some practitioners, they can be not aware about everything. So they can say, no, everything is good, it's very gentle. Radiofrequency cannot be gentle enough. Laser cannot be gentle enough. Ultrasound, microcurrent, please
Yeah.
forget about it for some period of time.
Yeah. Yeah.
You will be out of this forest.
Sure.
First step, when the treatment is finished and oncologist cleared you,
Yes. Yes.
it's great.
Yeah.
But the first year, still stay careful.
Yeah.
So in the first year of the remission,
Okay, there we go.
I always recommend to follow the same rules. Despite in the lot of discussion in the world of injectors,
Sure.
because technically fillers and even Botox injections, they are not forbidden during this period of time in the early remission because it's no scientific proof and it can be damaging. Maybe, I am too careful.
I was going to say, so you've given, of course, the client who is experiencing this the idea of what they ought to be doing. And for the practitioner, just to reiterate, it was sitting down with the client, understanding where they are, and then understanding what we can do, which ultimately we're so used to people coming to us for stimulation, for regeneration, for repairing. This is the one opportunity we get to just really be calm, be cool, and help a client relax and restore. I think that's one of our biggest things that we ought to enjoy is really just nourishing and restoring a client's skin. But then, how long do we wait and how comfortable do we feel? A client can look at you and say, I really feel good. I really want to do it. And I'm 6 months into my remission. Let's do it. That's such a personal decision to make as a person, but then as a practitioner, I would say you would always advise us to be more careful.
It's a personal approach because technically, yes, you can do for injections in the first year of remission. Still, it is not recommended to go for energy-assisted treatment, but injections, okay. But me as a practitioner, I will not recommend it. Just staying careful. So I would definitely go for peptide-based topical solution for wrinkles treatment at this period of time because peptides work well, they're not systemically absorbed, they still relax the skin, they still help us to boost collagen synthesis topically, but not in any of other places. I feel safe with peptides.
So within the first year of remission, you feel safe at least with a practitioner doing an energizing treatment topically on our client's skin?
Yeah, in this period of time, if we're not speaking about it, obviously, if it was facial skin cancer,
Of course.
stay away.
Of course.
But if it wasn't located on their face or the head and neck, so we can do some topical energizing treatment using niacinamide, for example. Still no devices.
But we
using niacinamide,
the protocol from Redapax
absolutely.
to doing something now to target.
Redapax, it's the best procedures, best biofascial during the period of the therapy because we still can go for Redapax and during the first year. But also we can use another treatments as well as long as they are topical. And they are not excessive stimulation. Also, I will stay away from all treatments and intense skincare, which is speeding up the skin renewal process because skin is too sensitive.
Sure.
And the first year...
It's already fighting for its life.
So you read my mind.
Yeah.
And also all immune cells in the skin will be overreactive during the first year. So they will release histamines, they will release all these pro-inflammatory substances. So it will be almost impossible to prevent inflammation or redness or flaking. And I prefer to stay comfortable because it was a hard period of life. It's so important to stay beautiful and to enjoy the skin comfort because it's really helps a lot to get back your nice life.
Absolutely.
And starting from the second year of the remission, you're officially cleared off for injections if you wanted, and you're cleared off for gentle energy-assisted treatment. So it is possible to perform microcurrent therapy. It's possible to perform the light therapy locally, topically, face, neck. It will be possible to perform IPL, for example, epilation, acne treatment, pigmentation treatment. It will be possible to go for multipolar gentle radiofrequency therapy as well, but probably not for this intense therapy like Morpheus or HIFU.
Right.
Or carboxy laser intense. Because you are still in recovery period and you will be in recovery until 5 years. It depends on the type of the cancer and the body reaction of the cancer. But once again, I am not the brave doctor. I am cosmetic safety expert.
Exactly.
So I always recommend to stay away from all this intensity.
Err on the side of caution. I am so grateful to you for going over this and just giving us a little bit more confidence in what we can do, because as I'm listening to you, sure, it can take you maybe 2 years to get to doing the injectables or the whatever, but I say whatever because I'm just so excited and I'm appreciative of this conversation. What we do is definitely not whatever. These are super in-depth treatment plans that we're coming up with. And it can take 2 years to get there with someone who doesn't have cancer. Someone who's, hey, I don't do these treatments and I don't know any of you for any of this. So it's going to take me time, but let's build up my barrier. Someone with acne, let's reduce the inflammation of the skin. Let's get it to a point where, sure, I can help to improve your acne scars and do a microneedling treatment. But sometimes that can take 2 years. So the reality is, it is a long time, but it's not like this is a time that we spend with almost all of our other clients and building trust and building a relationship and a treatment plan.
It sounds such a long time, 1 year or 2 years, but do remember what you did 1 year ago in the last June.
Actually, I do. I really do, yes.
Does it feel like it was long away? No, it was yesterday.
It's just yesterday. It's true.
Right?
Yes,
It's what I say to my patients for 30 years. Every time when sometimes say me, oh my God, it's so long. I always ask, okay, it will take 6 months. Do you remember what you did 6 months ago? And 100% of people, they feel like it was yesterday.
Yeah. It's true.
It will go fast.
It will go fast.
You will be healthy.
You will be healthy. And the last thing I think I wanted to encourage practitioners to do is have some sort of plan for that patient when they walk through the door. Have some sort of option for them, because they may be looking at your menu and they may think, gosh, your custom facial, it sounds incredible, but I can't even get any of those modalities. Like, do you have a facial that is appropriate for me? And does the cost reflect what you're able to offer? And I don't know that enough of us have a plan for that patient that's going to walk through the door. And I think they want to see themselves represented on our menus and in our spaces.
So our takeaway message for all practitioners, please be supportive.
Supportive.
Our takeaway message.
Be curious. Be curious.
Be curious.
To know. So lastly, I think I would say, because I know most people would like to go back to their doctor to say, hey, this is the treatment plan that this esthetician is recommending. Do you want me to move forward with this? Is that what you recommend? Do you recommend that an esthetician confidently say, hey, I offer red epox meta treatments. You're golden. I know your doctor will approve of this.
I think that's what I recommend for practitioners to do, because I always recommend for patients to be sure and to discuss it with their oncologist. And I always give the full information about the treatment, including all ingredients to bring to your oncologist. With a short explanation how it works. So everyone feels safe, because oncologists, they're not obliged to know what kind of mushroom extract we are using.
Truly.
And organic doesn't mean safe in 100% of cases. So I absolutely agree with oncologists to be careful about all kind of recipe and even skincare. It is a good thing. But provide with an information, explain, give some kind of professional leaflets.
Yes.
Or even the copy of the training book.
Yeah, absolutely.
And let's help each other. Let's collaborate for the good of our patients. Thank you for joining us today on the Medder Beauty podcast. If you found this helpful, be sure to subscribe so you never miss an expert skincare tip. Have a question or topic you'd like for me to cover? Send me a message at podcast@medderbeauty.com and let's keep the conversation going. Also, you can visit medderbeauty.com and discover Medder Skincare, which I created. And if you enjoyed the show, I'd love if you left a review. It helps others find the podcast and keeps us growing. Until next time, stay healthy, stay glowing, and take care of your skin.